Well, I think the level of training that they provide is among the best I've ever experienced in any venue with any material or procedure. And the hands-on training in the clinic is unique and outstanding. The best, again, there have been other hands-on programs I've been involved in, and this is certainly at the very highest level of training. So again, I give a lot of appreciation and kudos to Millennium for making sure the training is accomplished and making sure the training is at such a high level that it virtually ensures that the practitioner adopting LANAP procedures in his or her office are going to be successful from the very beginning and confident from the very beginning. Well, the importance of the study is it validates the claim that Millennium has made based on their clinical results and radiographic results of regeneration, because that's a histologic term. So the study validates that claim in the finding that virtually universal occurrence of new cementum and new connective tissue attachment to the tooth, which is totally different than most other healing processes from periodontal therapy.
What made you decide to engage in this clinical study to begin with?
Actually a challenge to Millennium and from Millennium about what was needed to convince me to be interested in lasers, because I wasn't at all at the time, and literally told them that if they were going to make those claims of regeneration, that they had to have some evidence. And they asked me what evidence was needed. I told them the best evidence was human histology, and they said, you know, would you be willing to do the study? And I said, sure. And so I kind of got in by the back door in a way. What's happening now is the referrals for this treatment are being very much patient-driven, and that patients tell their friends, their coworkers, their family, and they say, listen, you know, you've got to go, if you have gum surgery recommended, you have to go see, in my case, Dr. Yukna, to see if he can use the laser instead. You know, everybody wins. It really does. Everybody wins. It's one of those unique situations we have in dentistry or medicine where we have a treatment that has very little downside, almost no downside to it. The only thing I really want to do to treat periodontal disease, really have not done a flap for periodontitis treatments in almost 2 years now, because I just don't want to do that. I know I can get a good result doing it this way. It's easier on me physically, it's easier on me emotionally on what I'm doing to the patient, and the patient response is so positive, both, again, emotionally and with reduced morbidity, as well as the clinical results that they see.
Do you get hugged a lot?
Oh yeah, hugged a lot. That's a nice part of it too. The guys I'm not so crazy about. The girls are nice to hug.